Have you ever stood up and suddenly felt the room start to spin? Or felt so unsteady that walking straight became a challenge? That unsettling experience could be dizziness or vertigo. These symptoms are more than just feeling off. They often come from your inner ear, the system that controls balance. And when it misfires, your brain gets confusing signals. In this video, we'll break down what dizziness and vertigo really mean. You'll learn why they happen, what triggers them, and when to worry. And most importantly, what you can do to regain your balance and feel steady again. Dizziness and vertigo are common problems, but they are not exactly the same thing. Many people mix them up, so let's break them down simply. Dizziness is a general feeling that something is not quite right. You might feel lightheaded, unsteady, or faint. Some people describe it as feeling woozy or off balance. Others feel like they might fall or pass out. Walking in a straight line can suddenly feel difficult. Vertigo is a specific type of dizziness. With vertigo, it feels like movement is happening when it really isn't. You might feel like you are spinning, or swaying, or tilting. Sometimes it feels like the whole room is moving around you. Vertigo often comes in episodes. It may last a few seconds. It can last hours. In some cases, it can last days. Symptoms often get worse when you move your head. Changing position can trigger it. Even coughing or sneezing can make it worse. Some people with vertigo struggle to walk safely. Others feel very nauseated. Vomiting is also common. It can be scary, especially the first time it happens. So what actually causes vertigo? Most cases come from problems in the inner ear. Deep inside your ear is a balance system called the vestibular system. It is made up of tiny fluid-filled tubes called semicircular canals. Floating in this fluid are tiny calcium crystals. These structures constantly send signals to your brain. They tell your brain where your head is. They also tell it how your head is moving. This is how your body stays balanced. When this system is disturbed, vertigo can happen. One very common cause is benign paroxysmal positional vertigo, or BPPV. In BPPV, extra calcium crystals form or move into the wrong place. This confuses the balance signals going to the brain. The result is sudden, brief spinning sensations. They usually happen when you turn your head or roll over in bed. Another cause is Ménière's disease. In this condition, fluid builds up inside the inner ear. This leads to vertigo attacks. It also causes hearing loss. Many people notice ringing or buzzing in one or both ears. Vestibular neuritis is another important cause. This is often triggered by a viral infection. The virus affects the inner ear or the balance nerve. Vertigo usually starts suddenly. It can be intense. It may last for several days. People often feel extremely sick and unsteady. Head injuries can also cause vertigo. Even mild head trauma can affect the inner ear. The good news is that this type of vertigo is often temporary. Some people experience vertigo with migraines. This is called vestibular migraine. Vertigo may happen with a headache, or it may happen without any headache at all. Vertigo can also be caused by other problems. Certain medications can trigger it. Problems in the brain, such as stroke or multiple sclerosis, can also be responsible. These causes are less common but more serious. Knowing when to seek medical help is very important. You should see a doctor or nurse right away if vertigo comes with warning signs. A new or severe headache is a red flag. A. High fever is another concern. Double vision or blurry vision should not be ignored. Trouble speaking or hearing is serious. Weakness in an arm or leg is dangerous. A drooping face can signal a stroke. You should also seek care if vertigo lasts more than a few minutes and you are over 60, or if you have had a stroke before, or if you are at high risk for stroke, such as having diabetes or smoking. Even if vertigo comes and goes, it still deserves medical attention, especially if it keeps returning. A proper evaluation can make a big difference. Will you need tests? Maybe. Your doctor will start by asking detailed questions. They will examine your ears. They will check your hearing. They will watch how you walk and balance. They will also look closely at how your eyes move. Eye movements give important clues about balance problems. Sometimes more tests are needed. Hearing tests may be ordered. Balance tests can be done. In certain cases, an MRI of the brain is required. An MRI creates detailed pictures of the inside of your head. Treatment depends on the cause. If the cause is known, doctors often treat it directly. For example, in BPPV, special head movements can reposition calcium crystals. These maneuvers can bring fast relief. Medications may also be prescribed. They can reduce spinning sensations, they can help with nausea and vomiting. These are usually short-term solutions. If vertigo is severe or long-lasting, balance rehabilitation may help. This is a type of physical therapy. It teaches your brain to adapt. Over time, balance improves and symptoms lessen. There are also things you can do at home. Vertigo increases the risk of falling, so safety is very important. Remove loose cords and clutter from your home. Get rid of slippery rugs. Make sure rooms and hallways are well lit. Wear sturdy shoes with good grip. Understanding vertigo helps reduce fear. Knowing when to get help can be life-saving. And with the right care, most people improve significantly. Before you go, remember this: dizziness and vertigo are not just uncomfortable feelings. They are messages from your body that deserve attention. The more you understand them, the safer and more confident you become. If this video helped you make sense of those spinning or unsteady moments, give it a like. It really helps this video reach more people who might be struggling silently. Share this video widely with family, friends, and anyone who has ever said, "Why does the room feel like it's moving?" You could genuinely help someone avoid fear, confusion, or even a dangerous fall. Don't forget to subscribe for more clear, practical medical education you can trust. Hit the notification bell so you never miss our next video. And now, I want to hear from you. Have you ever experienced dizziness or vertigo? What did it feel like for you? Drop your experience or questions in the comments below. We read every single one. Stay informed, stay balanced, and I'll see you in the next video.